Don't stop.
Hi, thanks so much for joining me in the Everything and Anything in a Big A podcast. Before I get into my guest today, I wanted to talk about a few things. First, in case you didn't know, I have another podcast that I put out, and I put it out daily, and it's called Listen Up Girl. And Listen Up Girl is LGBTQ plus news that I bring. I usually try to do 10 minutes or less. Sometimes it goes over a little bit because there's a lot of stories. Unfortunately, a lot of it is what the orange convicted felon is doing to this country, and especially around transgender rights and trying to take them away. Today, I just did a news podcast report on, and I had 3 out of the 6 stories were what Governor Ron DeSantis is wanting to do to take away DEI and killing Key West Pride in 2027. It just goes on and on and on about what they are doing. And yeah, they hate trans people. And that's why my guest today is so important, because he is a man that is a true ally to the transgender community. I got approached to have him on my podcast. I'm like, this guy, he's a plastic surgeon. I was trying to think, what's the angle here? What are we going to talk about? And then I read a little bit about him, and he does top surgery. So interesting, because he knew nothing about transgender people until he got his first patient. I think it was 2012 or 2014. He talks about it in the interview. And he realized how important this is and how important, gender-affirming care is. And he is such an ally, and he gets it. And he has a practice that is inclusive. It feels inclusive when somebody comes in. They feel welcome. They feel like they belong there. And I was so impressed by him whenever we were talking. And we need more people like this in the world, is what I'll say, because right now the transgender community is so under attack from so many different angles, whether it's governors, whether it's the orange convicted felon doing it, whether it's bills and laws that are going through Senate and Congress, where they're trying to make laws, whether it's state level policies and legislation that's going through. It's really insane. I've never seen anything like this before, where they are trying to hurt a marginalized group that is less than 1% of the population of the United States, less than 1%. And all this effort and money and time is going through to try to impact these people's lives. It makes zero sense to me. But again, Dr. Blechman is the man that is helping people. He's based in New York City. And if people want to get top surgery, and what that means, in case you don't know, and he'll explain it a little bit in the podcast, but if you were born a woman and you have breast, but you want to be a man and you're transgender, and you would like to have your breast removed so you can be who your authentic self is, he will help you do that. And, because a lot of transgender men wear binders, which is basically flattening your breast. It's got to be painful. I mean, I don't have breasts, but I imagine having something pushed against you and flattening your breast must not be comfortable all day. So he is helping people live their authentic life. Also, if there is a transgender woman who is born a man and wants to be a woman and would like to have breasts so they can be their authentic self, he helps with that as well. And just the whole way that he approaches this is it was just refreshing to hear. So, and yeah, we need more people like him, as I said before, and I really enjoyed the interview. And when I was first approached, I'm what are we going to talk about breast for? I didn't really understand it. Now I get it. Now I understand why they reached out to me. If you are looking for something that he can offer, a service he can offer, you should reach out to him, because he seems to be, again, so inclusive of the community. He wants you to feel comfortable. He will talk you through things. Amazing. So I was really glad I got to interview him and meet him. He's has a float in the New York City Pride Parade. He's a real ally of the community. So anyway, enjoy my interview. And if you need his services, reach out to him. And also leave a message, comment on this podcast, and let me know what you think about it. Thanks so much for listening. Hi, everybody. Thanks for joining me in the Everything and Anything in a Bit Gay podcast. Today, I have a doctor on my show. He is a plastic surgeon. We have a lot to talk about. Welcome to the show, Dr. Blechman.
Thanks for having me. Happy to be here.
So let's talk about what your specialty is in plastic surgery, because you definitely have a specialty, and I want to kind of talk about how you arrived there.
Sure. Well, I practice. I'm a board certified plastic surgeon. I did my training I went to med school at NYU. I did residency at NYU. I actually did a fellowship at a place called MD Anderson Cancer Center in Houston, Texas, where I just did plastic surgery on patients who had cancer.
Okay.
About a year. I came to New York in 2013. I opened a practice, kind of just did anything, whatever would come in the door. And I did a lot of breast reconstruction, which is the kind of plastic surgery you do for patients that have had breast cancer, had a breast removed, and then we would make a new breast for them. And then in about 2016, someone came in the office and they wanted me to do a mastectomy for them. But I said, "You don't have cancer." And they said, "I know. That's not why I'm doing this." And I was like, okay. So that was when I first did top surgery for the first time.
Got it.
I'd never actually done that operation when I was training. And, but I felt it was in my wheelhouse. And I called a friend out in LA who did a fair amount of this stuff. He kind of walked me through a few tips. Did the operation, and whereas I was used to patients, after breast cancer, it's usually tears and Kleenex.
Yes.
And this was more like, "Hey, dude, you look great. High five after your mastectomy." And, the trans community is a very tight-knit one, and they like to talk online. And then all of a sudden, more people started calling my office. And soon enough, I'm on stages giving lectures at national meetings, and people are coming from, I think, 46 states now.
Wow.
And so about half of my practice is top surgery. The other half is mostly breast operations for cis people, breast reductions, breast augmentations, whatever it might be. But a large part of it is and has been focused around the trans and non-binary community. And I have another physician, an associate, Krishna Vyas, who works with us in New York and also does the same thing.
I mean, were you exposed to this before that patient walked in and asked for this? Or
I don't think I'd ever met a trans person until that person walked in.
Wow. That's so...
Yeah, so I'm kind of like an accidental tourist.
Yeah.
To some degree. But, it's a great community to work with, and I love it. I mean, I really enjoy being an ambassador, to not an ambassador, but...
Yeah, an ally.
Word, but just like a pillar of the community as far as healthcare is concerned. We offer a safe space, we do good work, we treat people with respect and do the best we can for them. So,
and we'll be right back. Okay, and now back to the show. Can you talk to me a little bit about, or just tell my listeners a little bit about, so it's top surgery, but is it also not just removing the breast, but adding breast for someone that's transgender?
Sure. Top surgery is actually a very ambiguous term. So when people say top surgery, usually they mean what we call chest masculinization.
Okay.
It could mean anything. So I always start every consultation with asking, I ask unless it's very obvious they want breast implants, but if it's not, I always ask, is it going to make you more comfortable if I do a surgery for you that's going to remove the projecting breast mounds from the chest and eliminate the feminine characteristics of the chest and leave behind a flatter, more masculine chest? And most people say yes, but not all do, because some people are just looking for something that we kind of made up the term. We call it a gender-affirming radical breast reduction.
Okay.
Which isn't a complete masculinization. These are usually people who are kind of moving, they're kind of fluid with a male and female presentation. And then, yes, there's another entire subset of people that we do breast augmentation for, mostly trans women, then we do breast augmentation for. So there's a mix, but the large majority of what we do is chest masculinization. And there's some data that supports that. That's the more across the country, that when people have some kind of gender affirming surgery on their chest or breast, most of the time it's a chest masculinization. Yeah. And the reason for that is probably because if you're, maneuvering through society and either, you're a trans man or you just want to present in more of a masculine way or less of a feminine way, whatever it is, how you want to present, it can be difficult if you've got double D breasts.
Yeah.
You're putting a binder. I mean, it just, there's only so much you can do. Whereas on the flip side, people who are trying to present in more of a feminine manner, you can take estrogen, you can get some breast growth just from hormones, and you can sort of pass as a small-breasted woman to some degree.
Yeah.
So that's why I think that type of surgery is just the most common. It's the most common thing we do.
And are you doing any other types of surgery for someone that comes in? So let's say it's a trans woman that comes in and wants to have more feminine features in their face. Do you help them with that as well?
We don't currently. There's a number of reasons for that. One, this just, as I told you earlier, this kind of grew out of my just doing a lot of breast surgery to begin with. So it just sort of made sense that we sort of stayed where we were the most comfortable. And we also designed a lot of systems to just make this work. A lot of patients use health insurance for this kind of thing. And even so, whether they're using the health insurance or not, we just have very good protocols that make it real easy to get all the breast stuff done. It's also, part of it is relatively easy to do outpatient breast surgery. The complication rates are relatively low, and when they do happen, they're pretty easy to take care of. Mm-hmm. Don't require a lot of hospital admissions. It just makes it easier to just run a practice that way. Because I'm not like, I don't work for a hospital. I'm not inside a hospital. So it doesn't mean that we can't do operations on people's face, facial feminization or facial masculinization, or even, surgery on the genitals for that matter. Mm-hmm. But we may hire some people to start doing that kind of stuff, but not currently. The only other thing we do besides breast operations in terms of gender affirming surgeries, we do some body contouring, which is mostly either liposuction on the abdomen or tummy tucks even. Yeah. That sometimes can be used, either to either reduce or augment the appearance of the hips.
So what was it? I mean, not ever meeting a trans person and doing this, how did you kind of wrap your mind around this? Because even me as a gay man, I'll say that I didn't always understand being transgender. I didn't understand.
You a lot of people.
Yeah. And so, and I didn't not like them. I just didn't totally understand it. And until I started doing this podcast, I've been doing this podcast for about 2.5 years. Literally, probably about 1.5 years ago is whenever it clicked, they were just, this is their choice. It's not hurting anybody for them to do this, whatever they want to do. They were born in the wrong body. And this is what makes them happy. So why does it bother anybody? So as a man that's never met a transgender person until then, how did you kind of wrap your head around it?
Well, there's that quote that goes something like, everyone's fighting a battle you know nothing about.
Yes.
Or something like that, I mean, look, I'm a pretty, open-minded guy. I've always actually been interested in meeting and interacting with different types of people. So it was nothing odd to me that this person was different in that way. And I mean, I'm a doctor, I'm here to help people. So, so I just started operating on these people, and, I learned a ton. I've learned so much in the last 10 years about the community, about what it means to be trans. I mean, I literally start every consultation just asking the question, just tell me about your journey with gender. Because I know that I've also learned that of course I respect people's pronouns and such, but I don't think of it, I think of just what is it that I can do to help you? Tell me what you, I'm not going to give you boxes to check.
Yes. So tell me about that inclusive care. So whenever somebody comes in, you kind of started talking about you're asking them what are they looking for? What's going to make them happy? So then kind of talk to me about that, because I think that's important.
That's what I try to do. I mean, I really, instead of, I know I was just talking about these different types of operations, gender affirming radical breast reduction, chest. I eventually can put some names to things, just mostly so that my staff and I can communicate about what we're doing and everyone understands. Mm-hmm. But the reality is that every single person needs what that person needs. Everyone's unique. So I really just try to let the patients, guide me to where, as a surgeon, I let the patients tell me what's bothering them. And I try to understand, what is the diagnosis, right? And then what I can do is basically tell them, well, here are the things that I can do to treat that. Mm-hmm. Then I can just explain to them the risks and the benefits of those
Yeah.
I'm a surgeon, so I do surgery. And then the patient can decide whether that fits their individual situation.
Yeah. And do you ever kind of think about the emotional weight that you're bringing off of people when you do this? I
Yeah.
mean,
Oh,
you're
100%.
you're like changing their life, and this is something they maybe have looked forward to their entire lifetime, and you're kind of like granting a wish in a way.
Oh, I'm very aware of that. I'm very aware of that. And we take that very, very seriously. And, we spend a lot of time. That's why we spend time like learning about the patients, learning about their story. We have people be seen by a mental health professional before we do surgery. And that's not to be an obstacle, but just to really just like learn more about them really, and
Yeah.
just make sure we are doing the right thing at the right time. And it's been incredible just to be part of these patients' lives, and especially the ones that I get to see, some time after surgery.
Yeah.
Every year we just actually signed up again. We get a spot in the New York City Pride March. We've done this, I think, 4 years now, 3 or 4 years, I can't remember. But we get a big pickup truck, some big transflex on it.
Yeah.
We invite everyone we've operated on. We usually get like 20, 30 people come, and it's awesome because some of them I've done surgery on years ago.
Wow.
I just had a patient, he's been shadowing us in our office. It's really awesome. I did surgery on him, I think like 6 years ago, and now he wants to go to medical school.
Wow.
And so it's like super cool because it's like touching. He's like, you inspired me to do this. Okay,
Yeah.
cool. Come hang out, see what we do. So yeah, it's really awesome. It's really awesome. I mean, we operated on this. I guess he's like an influencer in the community. This guy named Grayson, who is he's interesting. He's a personal trainer. He's got like hundreds of thousands of followers.
Okay.
Yeah, I did surgery on him, and it was wild. I mean, he took some videos of his he was taking his dressings off. It had something like 14 million views on TikTok. And it's been really interesting because, it's brought people that have come from, that saw that, and, it's great to be like a beacon by which these people kind of can come to, and that we can help them. And yeah, nothing makes me happier than like seeing like when they tag me on Instagram posts. I'm 1 year post top surgery. There's some picture of them at the beach with their top off. I mean, it's really wild.
Yeah.
I mean, it's great. I love it. I mean, it's really wonderful.
Talk to me about what you're doing with narcotic-free pain management. That's a big deal in today's world.
Yeah, a couple of things that we've innovated. So it's actually kind of funny how that came about. It came about because when they changed the laws in New York, maybe about 10 years ago, where it made it more difficult to write a prescription for a narcotic. I mean, it was for the purpose of, fighting the opioid epidemic, obviously. There was some patient that, I don't know, there was some problem with the electronic transmission. I couldn't, so then I had to like give them something else.
Yeah.
Okay, after surgery. And when I trained, I mean, everybody got narcotics. I mean, you could take like a mole off and you got like a week of narcotics. And it was like just roads. And so then I gave this patient some other medication, and like, sure enough, like they did okay. And so I thought, okay, well, this would be much less of a pain in my butt to have to do these go through all this rigmarole to electronically. Most prescriptions are transmitted electronically now, but when you electronically transmit a controlled substance, there's like an added layer of work to do.
Yeah.
So that's when we just started experimenting with we were using a drug called gabapentin, which is it doesn't have any real addictive profile. And there's a lot, it has its own side effects, but it can be argued that it's not nearly as, much of a problematic side effects as narcotics. And we started using that for a while and realized like narcotics are completely unnecessary for one. And then in the last few years, we've taken this a step further where it's really amazing. We need to publish this at some point, but we've got years now of data on hundreds and hundreds of people that we've done top surgery on and other breast procedures where we've perfected the use of what's called a nerve block, which is basically during surgery, it's actually relatively simple. I just inject some long-acting numbing medicine inside the rib cage. It's got a very, very extremely low risk profile of there being a problem from doing this. And then all we need to give patients is Advil and Tylenol, and only about 10% of people do we end up giving a prescription for something for? And not even narcotics. I mean, like my physician assistants don't even have a license to write narcotics. Like if somebody's narcotic, it has to be bumped up high enough to the to me, what's going on that this person needs a narcotic.
Yeah.
So we hardly even give anybody any prescription pain. I mean, I know I sound like a sadist, but I promise you, if you read our reviews, people are fine. The phone keeps ringing. But it's really amazing because it just creates so much less complexity after surgery, and so it's been an amazing innovation, at least for us, to be able to do that.
I mean, if you think about the opioid crisis that this country or the world has gone through, I mean, you're doing them a huge favor if you think about it. Really,
Yeah.
It's so addictive, and so I mean,
it's actually, interestingly enough, narcotics for acute pain after surgery don't normally lead to that problem, but it's still like it just floods the society with the medications, and so they can easily be what the DEA calls diverted, or like stockpiled or things like that. So we don't use any narcotics. We hardly even use any prescription pain meds anymore.
Wow.
Just Advil and Tylenol. Advil is very powerful when it's used well. And just to make sure it's clear, the nerve block is part of it too. And it's also a little bit of psychology. I mean, I do use some Jedi mind tricks and just kind of put this in perspective for people, because when you operate on the breasts or the chest, skin and fat, although it would hurt a lot if you were awake and I cut into it afterwards, it's not that painful. Not like when you cut into muscles and bones.
Yeah.
And so what I explain to patients is that, you're not going to have pain from this. You're going to be uncomfortable for sure, but you're not going to be debilitated. And I give them the analogy that every year I run the New York City Marathon. It's always on a Sunday. I always go to work the next day, and it always sucks. Okay, I'm sitting at my desk with like a bottle of Advil, and I'm groaning every time I get in and out of my chair, and it sucks again on Tuesday.
Yeah.
Definitely not on narcotics, let alone anything other than just Advil. And by Wednesday, it's a little better. And by Friday, I'm not even really thinking about it.
Yeah.
And I think a lot of them have a similar, once they understand it in that light, they realize it actually ends up being a very similar experience for them. Because believe me, if you tell somebody you're going to have a lot of pain, here's all this medicine, and like this is good, you're already establishing these links in the neurons of their brain to think that way. In fact, a friend of mine who's an anesthesiologist, she does a lot of work with ketamine therapy. It's really interesting what she does. And she thinks that the nerve block that we do, that it's more than just the actual anesthesia that will last for some time after surgery. But the fact that we do it before we even start cutting, it almost like tricks the patient's brain that it doesn't feel that initial trauma from the get-go. So when the patient wakes up, their brain's like, okay, like this isn't that bad. I'm not going to get all bent out of shape immediately.
Yeah.
And it's almost like a psychological shift that we cause in addition to a physical one.
Yeah. Talk to me about nipple tattooing, because I have not heard of this until I heard of you.
Yeah. Well, interestingly, there's a subset of top surgery patients, chest masculinization patients generally, that don't want their nipples, don't want to keep their nipples or areola. So they'll just have a flat chest with no nipple or areola. Now, those patients, if they ever wanted to change their mind, let's say, we can tattoo a nipple and areola on. It's just learning how to do it. Our physician assistants do it in the office. It's quite straightforward. And it's also very useful for patients. Sometimes there are patients who have a little bit of asymmetry, or there's some color mismatch. In a lot of top surgery, we have to, believe it or not, take the nipple and areola off of their body and then sew it back on. And the healing process for that can be somewhat variable in how it appears afterwards. And there's always possibility for asymmetry. So we can use that nipple tattooing as like a touch-up.
Yeah. And we'll be right back. Okay, and now back to the show. So you must hear some like crazy stories from people going to other surgeons trying to get something done. And then they come to you, and you, I mean, just from the 20 minutes or so that we've been talking, you really care about the community and about the people that you're serving and that you're doing, which I'm sure if some people go, I don't know, like anywhere in the United States, in the southern states, let's say, and they go to a doctor and they're not getting this type of care, or they're being looked down upon and stuff. So obviously you're prepared to do that. So tell me about that, how you have to kind of like take what another doctor messed up with or did wrong, make psychologically.
Yeah. Fortunately, we're not dealing with too much physical things that someone else has done wrong.
Yeah.
But yes, you're very right. There's not that much data on the trans experience in the United States, but there are some studies that are done. And one of the things they find is that there's definitely a large group of people that have a very negative experience with healthcare providers for one reason or another. So much of what we try to create is essentially a safe space, okay, that people can come to. We're going to respect them. We're going to give them the very best care we can. It doesn't matter whether they're gay, straight, trans, upside down, inside out. It doesn't matter.
Yeah.
Okay. It comes down to what can we help you with? And so we do that. And I think that's what kind of gets the word out, so to speak. And that's why, some people will travel from other places to have us operate on them, whether they can find the care in their communities or not. And then there are places who travel from places where they literally cannot find the care, either because no one's doing it or because it's just outlawed outright.
Yeah. What is your thoughts on kind of all these laws and stuff that are?
It's a challenge. It's the way our country is set up. I think ultimately it comes down to people have to vote.
Yeah.
Vote that stuff out. Yeah. Or be politically active. I'm very active politically with medical organizations. In fact, on Wednesday, I'm going to be meeting with a number of New York State legislators. I go up to Albany about twice a year with different medical organizations, talk to legislators. I'm even going to be meeting with, in Albany, and then I go down to Washington and do this with like senators and people in the House of Representatives too. And that's a great way to just get your thoughts across to them. Fortunately in New York State, I think this place is a haven for people of all types. It's been now written into the state constitution, I think 2 years ago. It even says in the state constitution right now, I think it specifically says gender identity as a reason that you can't discriminate against people.
Yeah.
So it's kind of hard coded here. And, and I do believe that it will continue to stay that way, at least for the near future in New York State.
Yeah.
I can't speak for the country as a whole, but.
And if, there's somebody listening to this, like a young person that's like or even not a young person, a little older person, let's say, and they are thinking about doing top surgery, what would you tell them?
Well, I think the best thing to do, as I'm sure anybody does, is go online. What's really interesting about the trans and non-binary community is that they have just flourishing online communities, whether it's on Reddit or even like Facebook. So they really know how to find out from each other a lot of information. And that's a great place to start, just to get like a sense, and to get an idea of what other people experience. I think it's never a bad idea to have a consultation with a doctor. For top surgery, generally speaking, the patients that we operate on, they're pretty far down the line in terms of their evolution, let's say, as they've kind of just moved through life, and that it takes them a certain amount of time to get to the point where they're thinking about top surgery. And it can be scary just to go into a doctor's office. It's actually a well-known phenomenon that when people are sitting in front of someone with a white coat, their blood pressure goes up.
Yeah.
But it can't hurt to talk to somebody. Information is more valuable than anything, really. And then hopefully just you're talking to someone who's giving you the right information about things. That would be my advice.
Was there a moment in your career, I guess, that kind of made you realize exactly why you do this work? Was there like one particular patient or moment, or somebody said something to you that kind of made you have that?
That's
thought?
Interesting. I think in terms of that little story I told you about that first patient I did top surgery on, that just something went off in my head. I was like, this is kind of cool. And it seemed interesting. It seemed a little bit esoteric, which just, I like that kind of stuff, just not run of the mill. And, and then it just built on itself. The more people I operate on, I meet such cool patients, and like just the more I do. I gotta say, like, And I say this to my patients that, they're some of the most inspiring people to me, because to have such conviction into your own sense of self that like you're willing to undergo surgery to like commit to that.
Yeah.
That's pretty inspiring.
Yeah, that's so inspiring. Well, I think that what you're doing is amazing. And I hope you do take often, and you do kind of reflect on how you're changing lives, like you're making people happy. And, I hope that you do kind of sometimes step back and think about, wow, like I'm doing some great stuff. And it's not just you're doing a surgery, you're changing a life. You're fulfilling dreams for people. And just your approach to it, the way that you've kind of talked about this, is really amazing. I mean, as part of the LGBTQ plus community, and just the way that you kind of talk about them, I can tell that you care deeply, and like they're it's rare and it's amazing. So I just wanted to say, like, I hope you do kind of reflect on that sometimes. So that's amazing.
Well, yeah, that's good. That's good advice. And we try to, present this, like even in our office, we've got, I get like hundreds of thank you notes, right? So like we have a huge, it's like a framed thing of glass with like, there's like, must be like 50, thank you notes from top surgery patients. We also, there's another patient that's did like a bunch of these like amazing like black and white photographs of themselves as part of some art project, and we have that framed in our office. So, we try to kind of like show patients, what the whole story here. It's not just surgery.
Yeah,
there's more to it later on.
Awesome. Well, if anybody is interested in learning more about you or your practice, they can go to your website. It's Blechman. I'm sorry, BlechmanPlasticSurgery.com. I will put a link in the description of this podcast or the video that you're watching, and check it out. You can schedule a consultation. You can do everything that you want on the website. And again, I think what you're doing is amazing. And I, we need more people like you in the world that really care about people. So it's amazing.
Spread the love.
All right. Well, thanks everybody for listening. If this resonated with you, or you think somebody please be sure to share it, and then check out the website. Thanks again for being on.
Thank you.